Good morning, everyone. Rise and shine. Thank you so much for joining us here on WEAC TV 24 with the Rise and Shine with the Alabama Cares program on this beautiful September day. Today is September 12th, 2025, and I am Ellen Tibbetts-Hurst, and I will be your host this morning as we have another great show lined up for you today. And some of you may not know, but our monthly event that we have every month, the Community Health Series, you know, the one that I always try to tell you guys to come to, is an event that we do monthly where I came together with the Healthcare Authority with Miss Carla, because she's been on the show too. Y'all might remember her. The Oxford Healthcare Authority, we partnered to have these free educational events every month. And well, today we have a treat for you, because today we have Dr. Carol Parks with us and Miss Lauren, who is the nurse practitioner. We'll let them talk about all that later, but they'll be joining me this morning. And she, Miss Parks, is actually the chief medical officer, right? They're actually going to have a new clinic, which we'll get to that a little bit later. But let me give you a little bit of background. So, Dr. Parks, you train, you oversee, and supervise all the healthcare personnel, right?
Correct.
Connected with the Healthcare Authority in Oxford. You were raised in a small southern Georgia town.
That's right.
Close to Savannah. I'm
That's
jealous.
right.
Savannah is awesome.
I know. It's fun.
Where your father was a surgeon,
That's
so it's
right.
kind of like in your DNA, I guess you could say. And you attended nursing school at the University of Florida. I'll forgive you for that. Okay. I'm just messing with you. Before going to UAB, where you worked in critical care and open heart surgery, correct? And for 10 years or so, you returned to medical school at the University of South Alabama in Mobile. And you have since, she's a smart cookie, guys. You have since earned a master's degree in exercise physiology and nursing from UAB as well. Wow. And she has worked in 6 different states doing emergency medicine in the ER. Okay, I feel this a little now. Okay, what a resume. That is fantastic. So welcome to the show this morning, and thank you so much for taking the time out of both of your busy schedules for joining us today. And so before we get to the new clinic, I want to start by you telling us a little bit how you got to be here at Oxford. Like, what was that connection? How did that come to be?
Well, I worked in the emergency room at the Regional Medical Center there in Anniston for a number of years, and was recruited by Tom Dixon, who's our CEO at the Healthcare Authority, to be the medical director for the EMS service about 5 years ago. And we've been doing wellness clinics ever since then for a lot of the staff, firefighters, policemen, the administrative staff there at the Healthcare Authority. And we're now branching out to include their families and to do some wellness with our clinic effort. Okay.
Wow. So I know that, you know, like Carla, she's getting all these certifications. I'm so proud of her. But you oversee the roles of the paramedics and the EMTs and all that. So So are you the one that has the say and tells Tom they should go get that certificate or they should go get that certificate?
We really have a push that all of us try to improve ourselves and keep certified in the latest and the greatest things that we can offer to the community. And so all the paramedics have been really encouraged and challenged to go ahead and get flight paramedic certification, to get trauma critical care certification, to get various certification efforts. And I have gone ahead to do flight paramedic medical director and to be certified in Botox and dermal fillers, as well as we recently, Lauren and I both have attended the peptide therapy certification course. And we've really been instructed in a lot of the newer medications and offerings for wellness, not just disease management.
Right. And I think it's pretty cool too, you know, in Oxford, I love the whole community paramedic thing. I wish that every town in America could have that. I mean, because, you know, I'm the program director with the area agency on aging, so I'm a program director I work with family caregivers. So you have a lot of elderly or just people that are maybe just sick, not necessarily older, from the older community, but just people that may just need checking on, and maybe their family lives across the United States,
Correct.
or they're overseas, or they're in the military, or maybe they don't have any children to check on them,
Right.
which I think is such a wonderful thing. So you guys go to their website and look up about their community paramedic program, because it's wonderful. And then Carla also told me that you guys have the capability of on the ambulances now, you can give blood.
Absolutely. And we can also do telemedicine with me so that they can call and I can see the patient, can get data from them, and be able to give direction to them on various techniques that they may do en route as they're transporting patients.
Isn't that fantastic? And I just think that that's just such a, and to me, even though, like, say, I'm just going to give this as an example. Sorry, Mr. Parrott from RMC, but even though, like, Anniston, for instance, has a hospital, versus Oxford that does not, and I know that that's why Oxford has a health authority, all that kind of thing, the technical part of it. But I still believe that the whole concept of the community paramedic, regardless if you had a hospital in your town or not, I think it's just a fantastic idea, because I can't tell you how much praise I give Carla all the time, because I feel it's so important, and especially people that, like I said, that may not have children or anybody to like check on them, or in that socialization,
Right.
having somebody to come check on them, and then she knows if they're getting released from the hospital down the road or whatever to go check their, their blood pressure or their glucose or whatever it is, and I just think that's fantastic.
And Oxford was the first
one
in the state of Alabama.
And I think Pelham
correct
followed suit.
And
after
a lot of people are asking now for us to train their system so that they can do the same thing that Carla does. And she also goes and visits people on a daily basis so that they can get their medicines double checked, get their blood pressure checked, their blood sugars, and whenever there's a need. And so that's a vital opportunity for people in the community that may not have it otherwise. They may not be able to have transportation. They may be bedbound. They may just want somebody to talk to about their health
the socialization part of it too. And that's only for you guys watching out there. It's only for the people that's in Oxford. You have to live within Oxford to receive these specific services. And speaking of Oxford being the first community health or the community paramedic, Carla came to me one day and she said, about a year and a half ago or whatever, and she said, "Hey, I couldn't ask anybody else better but you." She said, "Is there any way that maybe we could do some kind of," she said, "I don't know," she said, "some kind of event or something." So she and I sat there and brainstormed, and that's when the Community Health Series was born. And I still think it's baby stages, because we haven't really been there very long, because I'm a firm believer that something has to be there for a while and catch on kind of thing. So because you came to our event this week, and sometimes we have 10 people, sometimes we have 100. It just depends. But we were our area agency on aging was the first in the state
to do that
did education for a free monthly education program to the public. And you don't have to live in Oxford just to come to this. You can live in our 10-county region anywhere to come to this. And it's just a good way, again, in partnership with the Oxford Health Authority. I think it's just a wonderful way, because I feel that education is key in anything, and it empowers our community, and it empowers our citizens to be more active, have an active role in their own health, and I'm big on preventative things. So,
that's where medicine meets the people, and the people can ask questions. They can bring anything that they want to as a topic that they want education about, and it really benefits them in the long run.
Right, she said, "Well, I tell you guys all the time." I always tell our audience, where else are you going to go where you don't have to pay a copay, you don't have to pay a consult fee, you don't have to make an appointment, and you don't have to feel weird about asking questions. We have so many people. We've had everything from the Better Business Bureau come and talk about scams, frauds, and identity theft. We've had doctors such as yourself come and speak. We've had people come and speak about emergency management, about safe weather, what to do in case of weather. I mean, we've had the domestic violence agency come and speak. We've just had so many different subjects, and sometimes, I always say here too, we talk about the dark subjects too, because you got to talk about them,
right?
Right. So, and I just feel that the Community Health Series every month is a place where you can go and get a lot of information, education, and like you said, ask those questions that you normally wouldn't be able to ask. So there's a lot going on in Oxford. So we're talking. Is there anything else? I mean, on that end of the spectrum, before we start talking about the clinic, is there anything else?
Well, the other thing that we can do is telemedicine from the home. When Carla goes into a patient's home, she can then call me, and I can give direction from the patient's home about any new medicines or any needs that the patient may have, or make a decision that this patient is critical and needs to go to the hospital now before it's too late.
Right, and that's when technology is awesome. That's when you want technology to work, right?
That's right.
That is wonderful, though, and and I know that when Carla talked about this about the community paramedic when she was on our show, I think it was like a year ago.
Right.
It's been a while. I remember getting so much feedback. People were like, "Well, where do we have to be?" And of course, like I said, you have to live in Oxford to receive those services. But there were so many people that didn't know about it. That's a shame, because there are so many people that could take advantage of it that would help them, and it benefits everybody. It even benefits the hospitals and the doctors' offices, I feel, because maybe they can she can nip something in the bud before it gets something worse,
or they can get medicines delivered to their home that they don't have to go sit and wait into the emergency room areas for hours on end, when they can get care immediately.
And that's another thing that, we had the president of RMC come talk to. That's one of the things that we stressed during that talk was, emergencies should be emergencies, and so visiting your doctor or seeing Carla if you live in Oxford would be a better way of getting their medicine.
Right.
Okay, so hold on to that thought. Okay, so we are going to take a short break for a word from our sponsors, and you're watching WEAC TV 24 Rise and Shine with the Alabama Cares program. We'll be right back. Don't go anywhere.
I want to live. The leading cause of death of young Americans like me is gun violence, and oftentimes tied to substance misuse. NBA, NFL, NCAA, most of you look like me, and our communities need you now more than ever. Let's make I Want to Live more than just a hashtag. Let's make it a movement. I am a baller against bullets.
I'm Alan Parnell, Parnell Insurance Agency. We've been here in Oxford and Alabama, Tallapoosa, Georgia since 1990. With Auto Owners Insurance, we're able to give customers competitive pricing along with excellent coverages. Parnell Insurance can handle all of your personal, commercial, and life insurance needs. We have a very experienced staff, both personal and commercial. All together, we've got about 125 years experience. Come see what our insurance agency can do for you in Oxford, Alabama, and Tallapoosa, Georgia.
Auto Owners Insurance.
Hey guys, this is Blair Smith at Pediatrics Plus here in Anniston, located on Henry Road. I'm over here on the well side, but we do also have a sick side urgent care if you need us. We are more than happy to see you guys. Just come on, check us out if you get a fever, cough, or cold, or want to come in for a good checkup. Thank you.
Backus Bibles and Books is dedicated to providing churches as well as individuals with products and services geared towards strengthening every relationship with Christ. We specialize in Bibles, Bible imprints, Bible restoration, church supplies, home decor, gifts, and apparel. Call us at 256-201-1202 or visit us Monday through Saturday, 10 a.m. to 6 p.m. at 1100 Highway Drive in Oxford, Alabama. We look forward to serving you, equipping the people of God to expand the kingdom of God.
Welcome back, everyone. You are watching WEAC TV 24's Rise and Shine with the Alabama Cares program. Thank you for joining us on this very early morning. But we've been talking to Dr. Parks Well, and Miss Lauren too, about some things going on in Oxford about the community paramedic and all what you do with that. And if you guys missed the first segment or you want to share this with someone, make sure that you go back. You can go back to our Facebook page at WEAC TV 24. There will be a link there. You can always go back and watch it. Or you can go on YouTube, remember Roku, Fire Stick, Apple, all the things. You can go and look at it. So make sure that you share it with everyone because this is great information. So we talked about the health authority and we talked about the paramedics. So now you're going to have a new clinic that's going to have a lot of things to offer, I hear.
Correct.
Okay, so first and foremost, let's start with where is it going to be located and what is the name of the clinic?
The name of the clinic will be Oxford Healthcare Systems Primary Care. And primary care will offer a number of things that are vital in the community. We will have walk-in patients. We will have a lot of health and wellness to offer, and we'll get into that, about the various things that we're going to offer.
Say the name again.
Oxford Health Systems Primary Care.
That's a mouthful. I'm not going to remember that.
And it's
I'm just going to say the clinic.
It's right next to the City Hall.
Oh, so it's going to be
Oxford.
located next to the City Hall in Oxford.
Correct,
Okay.
correct. And we'll have...
So Office 78. Okay.
Right next to the City Hall. And it will have the ability to be open from 8 in the morning until 6 at night, 5 days a week. And on the weekends, we'll be open from 10 to 4. And we
On
hope
Saturday or
on
Saturday
and Sunday.
Oh, okay.
And we hope to be able to be open early in October, but it's a soft opening. And
Okay.
so more information can be found on the website, on
What's
our
your website?
too.
What's your, tell
And
everybody
it's oxfordhealthsystems.org.
oxfordhealthsystems.org.
And there'll be a
Oxfordhealthsystems.org.
separate part that says Oxford Health Systems Primary Care that you can click on.
Okay, so once you go to the website, then you can go to the clinic.
Correct,
Part
correct.
of it. Okay. So, well, how did this come to be? I mean, how was this born?
It was born because for about 3 years now we've done wellness checks for the firefighters in the city of Oxford, for the EMS, for the police and SWAT teams, and for the administrative personnel. And you know what we noticed? We noticed that after we sat down and really worked with patients on an individual basis, on a quarterly basis, every 3 months, we noticed that people lost weight, they decreased cholesterol, they decreased blood pressure, and they got diabetes under control. And so
Because they probably wouldn't go into the doctor.
that's right. And they weren't following through. And so the mayor and the council challenged us to do something further to assist them with their health care. And so we're going to open this to those same personnel and to their families and to the public.
Oh, so it's everybody. So
Correct.
So do you have to have an Oxford address to come to the clinic?
Not necessarily.
I mean, so anybody in Calhoun County could come,
Can come
to
to
it?
the clinic.
Or anybody, like, say, if they lived in Montford, which is right there on the, I mean, it's Talladega County, but
Right,
it might as
they
well
could
be
come.
Oxford.
They could
I
come.
think. Yeah, okay, so that's good to know. So, and you're right, my husband was a first responder, he's military, so I could see that.
Right,
I could see
right.
that. So, so we were talking about, you said there's going to be a soft opening in October, and so you've already got the building.
The building is
so you said,
furnished.
because I know she told me that there were some people opening boxes at the clinic.
That's
So
right. They are
They're
right
decorating.
now.
They're decorating.
This Friday morning they're opening them.
Okay, gotcha. Oh, there's some pictures of it now. There's some,
Yes.
Yeah, it's gonna be
It's
nice.
a very comforting atmosphere. We're going to be able to offer some aesthetics and some opportunity for things that you may not find in many primary care practices.
Oh, okay. All right. So that's interesting. So what services? Let's start with that. Well, then what services? Oh, there you are.
Yes.
So What services will you then offer?
Well, we hope to offer the traditional services that if you cut your finger, you can come and see us as a walk-in patient. You don't have to wait if it's a weekend, or you don't have to wait in line in the emergency department for something that may be a minor injury.
Right.
Of course, if this is a major event, then you do need to go to the emergency room.
Yeah, emergencies are emergencies.
Right.
We say that all the time.
Right.
But if it's not an emergency, it's probably not a good idea to
Or
go to
you
the
wake
emergency
up and you're about to go to church on Sunday morning and all of a sudden you feel like you have a urinary tract infection.
Right.
You can come see us and we'll get medications ready for you at the pharmacy. We also will offer some non-traditional types of medicine.
Because I know you said something about Botox
and dermal fillers.
all that kind of stuff. So,
Right.
talk a little bit about that.
Well, now those need to be scheduled with an appointment, but we will be able to offer some of the latest Botox treatments for forehead, eye wrinkles, and I think we have some pictures of that. And then we can
There it is.
offer some dermal fillers to get rid of some of the marionette lines around the mouth that
I call
pull your
those
mouth
apostrophes.
down. Yes.
Well, not apostrophes. I call them parentheses.
Parentheses, and some of the small fine lines around the eyes. You can see that afterwards they're much more
Quotation.
pleasing. Correct.
Quotations are not supposed to be on your face.
Uh-huh. And look at the gentleman with the wrinkles in his forehead and how nice that looks afterward.
Right.
And so a lot of times for both men and women, this is a positive aspect that they can partake in. We are also going to offer IV therapy, IV hydration for people that don't have congestive heart failure and they may need a pick-me-up, an energy boost.
Like vitamin B12 shots
Correct,
or something
correct.
like that.
With various other supplements or herbal medicines that they can use to help
Give them more energy.
right and give them kind of a boost even during the holidays. During the
Right.
holidays time when you're frantic and going 90 miles a minute, this can help you with your energy level and your
Or
fatigue.
menopausal ladies.
And right, we're going to work with perimenopausal women
Yep.
to give some bioidentical hormones, some peptide therapy for men that may be wanting to forego the medications of traditional testosterone therapy. We can offer some alternatives to that.
Oh, that's
and
interesting.
We're also going to invest in a piece of equipment that's called the in-body scan that we do have some pictures of, and you can see your body metrics such as your skeletal muscle mass with how much visceral fat you have, what your inflammation level is,
Oh,
and you
wow.
can see this now and then go on some therapy that's going to make a difference and 6 months later see objective results of what's improved.
Right, and I'm a firm believer in preventative medicine. I mean, I really
Correct.
am, because my mom passed away with breast cancer at the age of 56. So she had it the first time at 35, the second time at 44, then she passed away.
Right.
So, you know, I get all the
Wanna
checks.
prevent that.
You know, I get all the checks. So I'm actually in the high-risk breast cancer clinic at UAB, so they keep a hawk eye.
Right,
You know, hawk's
right.
eye on me. So, which I'm good with that, you know. But I do. I have two I have 2 mammograms a year and an MRI. You know, and my friends are like, "Oh my gosh, you do that how many times a year?" And I'm like, "Look, I see my mama
It's worth it.
suffer.
It's worth it.
And I'll do that any day over what my mom went through." You
And
know?
speaking of cancer, another thing that we offer in primary care, which is very rare, is a dermasensor, which is a type of new technology that can help detect at very high levels of specificity and sensitivity if you have a particular lesion, whether or not that could be skin cancer. Dermatologists have a similar type of use in their office, but in primary care, many physicians don't have that
They miss
opportunity
it.
and they don't have the capability to get the
And
patient
that
in.
is very true, because I had melanoma. Mm-hmm. Okay.
So did I.
In 2020, and that's no joke.
That's right.
You know, and I didn't even know I had it because it was to the naked eye. I mean, like to your eye,
It just
you
looks
couldn't
like
even,
a little dot.
Well, it was on my face, and it was like a little skin tag. And you know, when you have a skin tag and you pull it, it'll bleed for like a second or two, and then it'll go away. That gushed, and it was on my nose. And when I went to Dr. Monheit, my dermatologist, he got rid of the cancer, thank goodness. But I had a hole on my face. part of my nose was missing. So I had to have 5 plastic surgeries. So, and I'm telling you this to say this.
Go get it checked.
Get your skin, your skin scans, because if you grew up in the 80s and the 90s like I did, and we worshiped the sun, we shouldn't have, but we did.
Well, look at Jimmy Buffett.
Right,
Yeah.
you know, and I mean, and not only that, I mean, sunscreen.
Right.
So, and when I went for that, when it was gushing, I went to a regular, you know, just a general practitioner, and you were correct. They did not know, you know, until I went to my dermatologist and said, you know, because they referred me to my dermatologist. So that's fantastic that
Yes,
you'd be able to do
yes,
that.
we will be able to do
so,
that.
because sometimes with like with specialists, especially, it takes a long time to get in with them.
To get in, and by then you've had months down the road
Right.
that you haven't had the treatment that you
That's
deserve.
fantastic. I like that. That's wonderful.
Very
So,
good opportunity.
Yes, and you need to make sure that we all need to make sure that we take advantage of this opportunity
Yes.
for this to be right down the road from us. This is wonderful. So you're going to do your basic walk-in clinic kind
Correct.
of thing, like if somebody has sniffles or
Absolutely.
anything like that, or somebody they think that their blood pressure is high and they can't get it down, or something like that, right? So, or your kid falls. So, well, that's a good question to have then too. So, if are you going to have the capability of X-rays or anything like that? Or are
Yes,
you guys going to do
very
that?
much so. We'll be able to do chest X-rays, extremity X-rays, and
So,
be
like
able
if
to
somebody
diagnose
thinks they broke their finger.
Correct. Correct.
Okay.
We cannot do CAT scans or MRIs, but we can certainly make referrals for
Oh
those.
yes,
during
definitely.
the
But your basic
traditional-
X-ray you'll
Correct.
be able to do.
Correct.
That's wonderful that you guys are getting. So I have to ask, because I know the audience is going to want to know. So did the city of Oxford fund this, or was there a grant that you guys got, or how did that work?
The city of Oxford challenged us to be able to do this, and we're going to try and make it cost effective for us. But we don't have any grants yet. We're considering some options with that. But mainly we were challenged with, you did such a good job with the personnel in the city of Oxford, the firefighters, the paramedics, the police. Now let's take this a step further. And we do have a vision for the future, which may include a larger scale and possibly even a hospital in the future
Ooh, did you guys hear that?
in Oxford.
Wow. So who knows? There's some good things on the horizon maybe in Oxford, Alabama.
That's right.
I always love it though that when our area grows, I mean that's awesome because you can never have too many resources,
Right.
I feel. And I also feel like a little competition keeps everybody, you know, I think a little honest.
Good. Yeah. And that's what we wanted to do, is offer something that the community wants, and that's what we've been hearing.
Right.
So that's effective for them.
Well, hold that thought, everyone. We got to go again. So we're going to take another short break for a word from our supporters, and you're watching WAC TV 24 Rise and Shine, and we'll be right back.
The weather is warming up and spring is just around the corner at Miller Sand and Landscape Supply. I'm Craig Miller, and we've got something for everyone. From bulk materials like sand, gravel, and mulch to beautiful outdoor decor to make your outdoor living space the envy of the neighborhood. See our beautiful selection of Mazzarelli fountains, flowers to brighten your garden, and an outdoor center loaded with beautiful decor. Whether you need a little or a lot, visit Miller Sand and Landscape Supply.
Hey, this is Jason at Reeves Insurance. Just want to say a quick thank you to all of our customers for your support over the years. We now have offices in Anniston, Alexandria, and Oxford in order to serve you better. So stop in and see me or any of our experienced staff and let us shop for you. We'll find you the best price and the best coverage available. Thank you.
The Civilian Marksmanship Program, also known as CMP, is a national organization dedicated to training and educating U.S. citizens in responsible uses of firearms and air guns through gun safety training, marksmanship training, and competitions. Their vision is to lead the nation in marksmanship excellence, providing safe, high-quality, and innovative programs with a focus on youth. For more information about the CMP and upcoming events, visit thecmp.org.
BPC 157.
Hello, everyone. Welcome back. You are watching WESC TV 24 Rise and Shine with the Alabama Cares program, and you guys missed the first 2 segments. You missed a lot because we talked about a lot. We covered a lot. I feel we covered a lot. So lots of exciting things happening in Oxford, Alabama with medicine and a new health clinic that's coming. So make sure to go back to our Facebook page for WESC TV 24 Facebook, or you can go to YouTube, Roku, Fire Stick, Apple, all the things. Make sure you go back and watch that, and make sure that you share with all your friends, because this is too good not to share. If you missed the first 2 segments, I'm telling you, you want to, especially the last one, you're going to want to go back and watch it, because there might be some exciting things coming to Oxford besides the clinic. It might be something bigger than that one day. So, but the clinic we were talking about all the things that you're going to be doing. So we talked about the walk-in clinic, and then how you're going to have the capability of doing like just your chest x-rays, your extremity x-rays, nothing like too fancy schmancy, right?
And we didn't say lab work. We can do
lab
a
work.
lot of lab work.
That would make sense.
Your general lab work plus some specialty lab work to look at various hormone levels, to look at various vitamin levels, heavy metal levels. If you're having certain symptoms that may indicate that you need those done.
Right. And then she was also talking about how they're going to provide, like your cosmetic things, like your fillers and your Botox and all that. And speaking of what you were talking, you just said like lab levels. I mean, I think that's so important, especially. I think your walk-in clinic may be a little bit different than all the other walk-in clinics when it comes to, for instance, I have 2 friends, well, I actually have a family member and a close friend of mine who went through, went through a lot to find out what was wrong with them. And one of my friends, it took her 2 years for them to figure out what was going on with her, because they kept blaming it on menopause. And it was autoimmune. So, so there's a lot to go with that. So there's a lot to say that you're going to provide some different things that other clinics maybe do not provide, and look at things maybe from a holistic point of view too, or just all these different aspects, which I think is wonderful. I mean, why not look at it from all different kinds of aspects, right? If it works, it works. And so one of the things that I want to ask you about, because you touched on it a little bit in the first segment, I think, when we were talking about the different things that you'll provide, you were talking about peptides. So explain to us, Lauren and Dr. What these peptides are.
Okay.
Well, like Dr. Parks said, we just came back from a peptide seminar, very informative. It's cellular medicine. We are taught to treat these diseases, and we throw medicine at, but
not everybody likes medicine.
Not everybody likes it.
I'm one of them.
It has side effects, which, most things do. But with the peptide therapy, you're really trying to get to the root cause of an issue.
Correct.
We want to live our best lives. We want to be healthy. We want to feel good. And sometimes you don't feel like yourself. And
medicine makes it worse sometimes.
And it's checking things like your lab work and your hormones. There's different kinds of peptides, that increase your energy levels. They basically reroute your gut microbiome. Things like BPC 157 is one that's used fairly often.
These are all natural things. Is that what you're talking about?
Correct. Peptides, yes. But again, just kind of get into the root cause of why do you feel so tired all the time?
Right. And I think that's wonderful, because how many people, like I said, my friend, oh my gosh, bless her heart, she went through it, for 2 years. Every doctor said, oh, well, you're just perimenopausal, or you're just this is why your hair's falling out, this is why you're this is why you have your weight gain, this is why you're breaking out and doing all these, her body was doing all these weird things. She had, arthritis real bad. She was hurt all the time. She just had she was having migraines, all the time, and finally she went to a doctor and they said, oh no, that's not what it is. You have lupus. And she was like, oh. So once they figured that out, but it took her 2 years to figure it out, so that's horrible.
Well, even the heart attack and strokes are now blaming immune mechanisms for the reason that starts everything in the cascade down to the point that people have heart attacks or strokes. And, there are things that are preventable that we can use. There are peptides like Lauren was talking about that are longevity peptides that help us live a longer health span in our lives. There are peptides that help with muscle recovery, that helps with healing. If you have a particular illness or you have a particular cut on your body or you've had surgery, they help with healing. And many times people have been to 5 and 6 doctors with traditional treatments that haven't improved their setting, and now with peptides we can do that.
Okay, so I'm sure everybody out there would want to know, because I would want to know. So do insurances pay for these types of treatments?
That's a good question. They may not. If it's medically indicated, sometimes Medicare or the usual insurers will pay for that. Sometimes they may not, and patients may need to pay for these medications, which are not often terribly expensive.
Okay.
And they can be written as a prescription from a compounding pharmacy, and that we have local ones here in Oxford.
Okay, yeah, because I know that when my husband had sinus surgery, they gave him a compound to rinse his nose with. So, so that's good to know. And it wasn't expensive at all.
And they're often not, and sometimes just the knowledge of what the root cause is, like Lauren was saying, gives us an indication of what the right medicine is that can do the trick, that doesn't need, tons of different things.
And I'm sure too, you would, because you ladies are smarter than I am, but and I'm sure that too you would have to get like the whole workup of that patient, like their background and their medical history, and like, okay, let's see this whole picture. Let's look at this whole picture and see what's going on here.
And you can do body scans, like we have the equipment available, so that we can look at skeletal muscle mass and your fat distribution. 2 peptides that are in use today that have been approved by the Federal Drug Administration are the weight loss medicines, like Wegovy, Mounjaro, Ozempic. Those are peptides.
Whatever.
Semaglutide.
Yes,
Semaglutide, tirzepatide, and those are peptides that have made a whale of a lot of difference for a lot of people.
And too, I know that a lot of people that have used it said that heart doctors are all about it, because that the semaglutide. I said it right that time. The semaglutides, Wegovy, and those type things, they say that it actually helps with the heart health. That so many of their patients have, like, their labs and everything have just been perfect because of them taking those injections for weight loss. And I'm not promoting for you to go get Ozempic or Mounjaro if you're not diabetic. I'm not saying that, because
we can do that.
But diabetic, because I know diabetics, that's priority, that they need that, But I do know that there are other injections that people can get that besides that have the semaglutides or the Wegovy in them that can help, and I think that's wonderful. So if somebody comes to you guys, every time you go to the doctor, they'll always say, well, who's your general practitioner, or who's your
doctor,
your
primary care
your
provider.
Primary care doctor or whatever. And I always have to say I don't have one. I have a lot of specialists, but I don't have a main doctor, and I need to get one. But
well, you can come and see us.
That's what I was going to ask. So if somebody's looking for that person that's their primary doctor, can they come to your clinic and then claim you guys as their primary?
Yes.
That is fantastic. See all the good things that are happening in Oxford, Alabama. Aren't you glad you watched this show?
Yes.
So I love this, because I feel it's so important to educate our community, and I think it brings you into their living room to make it a little bit more personable, so that when they come to your clinic, they'll say, "Oh, I saw you, and, and heard you talk," and I think that's wonderful. So.
Well, thank you for doing that for us.
Well, I love this. I love it. I'm very passionate about educating our public. I am. I think it's wonderful. And I think it's wonderful that you guys took it upon yourselves to be educated about all the peptides and all that. That's very interesting.
Oh, it
how
is.
interesting
It was
how
very
your body.
eye-opening.
Yeah. And, you know, because so many times, you know, thank goodness, I mean, I thank God every day for doctors and nurse practitioners like you all the time. I mean, you guys do not get thanks enough. I mean, I'm always thankful that God gives you that gift, you know. But I also know that, you know, and I'm thankful for medicines too. You know, I really am. There's people that wouldn't be here without medicine.
That's
you know,
right.
I understand that. But then at the same time, I feel like if there's something natural, because a lot of times you have to trade off symptoms
Side effects
and side
of
effects of
medicines,
one
yeah.
medicine to get rid of another ailment that you might be in. You know, sometimes
Well, the other-
that's why I don't like medicine. I'm just like, oh, do I have to take
Well, the
that?
other thing too is it's very interesting, and we were talking about that this weekend a lot too. The more that people will get out and exercise and change their diet for positive nutrition, positive aspects in their lives, the better they're going to live
And
longer.
people don't want to hear that, and I preach that all the time.
Even just walking.
Because I taught a wellness class for my older folks, and at one of the centers, and I would tell them all the time, just walk to the mailbox and back. You don't have to start off big, just walk to the mailbox and back.
That's right.
You know, but it makes sense because when you're exercising, oxygen's going all through your body,
There you
and
go.
oxygen is carried in your blood, and it goes to all your main organs. And then I had a back doctor, a spinal doctor that was on the other week, well, last week, and he even told me, he said, when people sit, you know, your organs are just going away. I mean, and your core and
You're
everything,
wasting,
like, you know,
yes.
you're wasting away. So it makes sense. It makes a lot of sense. And we do not, and we live in the South, we especially don't want to hear diet. I mean, because we fry everything here, you know. Well, when you fry Oreos and honey buns, I mean, there's an issue. You know what I mean?
Well, if just people trade out chicken or fish, fresh fruits and vegetables instead of processed ones.
And I tell folks to do little steps.
That's
you
right.
know? Don't do
That's
it all
right.
at one time, because if you do it one time, you're not going to stick with it.
Right.
You know, at first, trade out your bread. Then
One
do
of the
that for a
things
little
we
while,
talked
yeah.
about this morning in the session that we did at the Civic Center was a substance called spirulina, which is a green sea algae. And it has a lot of antioxidant properties in it, a lot of vitamins, proteins, and it's very good. You can mix it in your yogurt. It turns it green, but
Oh,
you
dear.
can't taste it. But it's very good. Publix has those now in their
Hold that thought. We're going to go back to that in our last segment. So we're going to take another short break, I'm sorry, for a word from our supporters. You're watching WEAC TV 24 Rise and Shine with the Alabama Cares program. We'll be right back.
On average, a tow truck operator is killed every 6 days in the United States. A tragic, yet preventable event. The fact is, most people don't know what it's like being a tow truck operator. The dangers that occur while servicing a roadside vehicle are real. However, you can make a difference to help lower this statistic and save lives by simply slowing down and moving over. This simple task can prevent an unnecessary death and allow workers to make it home to the families waiting for them. After all, it's the law in all 50 states, for good reason. Do your part so they can live another day and be there for you when you need them. Move over. Their lives don't belong to you.
Backus Bibles and Books is dedicated to providing churches as well as individuals with products and services geared towards strengthening every relationship with Christ. We specialize in Bibles, Bible imprints, Bible restoration, church supplies, home decor, gifts, and apparel. Call us at 256-201-1202 or visit us Monday through Saturday, 10 a.m. to 6 p.m. at 1100 Highway Drive in Oxford, Alabama. We look forward to serving you, equipping the people of God to expand the kingdom of God.
I want to live The leading cause of death of young Americans like me is gun violence, and oftentimes tied to substance misuse. NBA, NFL, NCAA, most of you look like me, and our communities need you now more than ever. Let's make I Want to Live more than just a hashtag. Let's make it a movement. I am a baller against bullets.
Hello, everyone, and welcome back to your WEAC TV 24 Rise and Shine with the Alabama Cares program. I'm Ellen, and I'm sitting here with Dr. Parks and Miss Lauren, and we're talking all things healthy. But before we start our last segment, I can't believe we're already on our last segment. But before we get that, I don't tell all my secrets, so I have to tell you, I'll surprise all my guests. So it's Friday, so we have to do the Friday dance. So it's Friday, everybody dance. It's Friday, yay! Good. We only had one person ever that said no, so hopefully I'll get that. So yeah, it's Friday. Hope you guys are having a good one, and I hope it's we're starting you on the right path going into the weekend, make you think about some things. But you were talking about the green yogurt during the break. Tell the folks about the green yogurt.
Publix makes a parfait that you can get, and it has fruit on the top and a little bit of granola. And so the other day I was there and I picked up one, and it was green instead of the normal white yogurt.
Yeah, like a creamy yogurt.
Right. And so I handed it back to the lady behind the counter, and I said, I think this one's spoiled. And she said, oh no, that's the new substance called spirulina. Spirulina.
Okay.
It's a blue-green algae, and eaten alone, it tastes a little bit like sea moss, like you would expect sea moss to taste. But if you put it in the
like
yogurt,
you
can't taste
or
it.
Something maybe.
Correct.
Okay.
Correct. It's a little bit sulfur, salty tasting, but it's very healthy because it has a number of minerals, proteins. It has iron in it,
probiotics,
and it's an antioxidant and probiotics. And so it's a great little boost for a morning snack. You could have some with your program.
Yeah. I could have some for that.
Yes.
And you know, it's amazing to me, like all the new supplements that have come out, and I'm just like maybe the last 10 years. It's amazing how far research has come and everything. Because I think all the time, man, I wish I would have found that. You know, back when I was younger, or knew about that.
When we were young, the only thing you could get at fast food restaurants were burgers, fries, and Cokes. Right?
Yep.
Now you can get salads and water
and wraps.
Right, a lot of healthy options no matter where you eat these days. And so it's a great way that our society has changed.
I agree. And I think, don't you think that adding some of your supplements actually helps you to prevents you from maybe going on other medicines one day?
Oh, it definitely does. And to lose weight and to exercise, people have done remarkably well with changing their diets and increasing their exercise, because there's only one way to lose weight.
Yeah.
And that's if you burn up more calories than you take in.
And you can't just, and you know, I've told folks before, you can't like lose weight
and then go back
and then just sit at home. You know,
right.
I mean, you have to watch your calories. That's true, but you still have to move.
Mm-hmm. Yes.
I mean, you still have to move.
And it doesn't matter if you want to do low carbs or low protein or low fat. If you can add the exercise with it so that you're increasing your output, then that's going to be beneficial.
I used to compete in fitness. I mean, not everybody knows that, but a long time ago. And I'm a firm believer that I hate the word diet. I hate that word, because I'm not on a diet. I just changed the way I ate.
Correct.
And I changed the way that I looked at eating. So I didn't look at, don't get me wrong now, I love me some fried okra and, all the good things, right? And there's nothing wrong with that, to treat yourself every now and then, but don't eat like that every day, 3 meals a day, right? So, I think it's a very important, especially for your older generation, to get that out of your head. We're not saying go on a diet. It's just change your eating habits, right?
And incorporate more supplements, vitamins, minerals, fruits, vegetables.
Yes, I agree. That's a better way of looking at it, because because if you say diet, you're like, oh, I don't know if I want to give that up. But I will say, like I told you, at the break, I haven't had a soda in almost 4 years, and I mean, game changer. I mean, like game changer. You know, my husband and I go. Now I drink coffee. I have my cup of coffee every morning, but I drink water, and lots of times I drink water with like a hydration in it or something, but sugar free. But a lot of times, like when we go out to eat or whatever, I'll have a tea, but you know, an unsweet tea or something. But it's a game changer because I don't feel as bloated.
That's right.
You know, the whole tummy thing, how carbonation makes you feel, and everything. So just that in and of itself was a big game changer for me because Diet Dr. Pepper was my kryptonite. Oh yeah. So I see that, and so don't get mad at the doctor, Miss Lauren, for telling you that because it's the truth. I mean, you need to exercise and move and. Because, you know, and too, working with the older generations, you know, I hear people say to me, well, when they retired, they just didn't do anything, and he was only retired for 4 months. He passed away, or, you know, but it's because they weren't doing anything.
They're not active.
And that's, you know, because if you don't use it, you lose it.
That's
right. And that's with everything, right?
Yeah, can't live that sedentary lifestyle.
No.
Right. You still have to move just because you don't have to be accountable to go to work every morning. You know what I mean? But you still, you have to be accountable for you, though.
Right.
This has been so wonderful. I hope you guys learned a lot. And we talked about the Community Health Series, so don't forget about our Community Health Series coming up in October. We already had ours this week, but the one in October is October 21st, and it's Cancer Awareness Month. And I'm working on trying to get somebody that's really, like, you really know a lot, but I'm having to persuade them a little bit. But I'll let you know about that later. But Cancer Awareness Month, we'll have vendors, door prizes, speakers, all the things. And then, of course, in November, it's Caregivers Awareness Month. And then December is Holiday Wellness Month. Holiday Wellness Month, we'll have Ryan Robertson come. He'll be singing all the holiday cheer. He'll be entertaining us where you can dance and have a good time, clap your hands and sing along. And then we'll have vision checks, hearing checks, glucose, and blood pressure checks by Ms. Carla. Group. And so, and then I think the health department will actually be there to give out flu shots as well. So that'll be really good. So, because you know, a lot of people, they just don't take care of themselves during the holidays. So that's why we always do a holiday wellness thing. And it's usually pretty big every year. So we hope to see you there. I think the Lions Club is going to be there for eye checks. And then we have Sam's Hearing is going to be there for the hearing checks. So, and then also mark your calendar. Go ahead and mark your calendars for November 14th. It's our 7th annual, already, look at that, wow. 7th annual Caregiver Conference. It will be held all day at the Jack State Fort McClellan campus. We partner with them. We will have breakfast and lunch for everyone, and our keynote speaker will actually be Dr. Rita Jablonski from UAB. She is a wonderful speaker. She came about 2 years ago, and we had such a high demand for her to come back. She has her own podcast. I mean, she's real, like she's in your face real. Good. Like this is the way it is. And she made some people cry, I'm not going, but not in a bad way though. It was one of those things you had to be true to yourself and look within, like a lot of people that maybe were in denial that their family had dementia, you know, that kind of thing. So you guys, she is fantastic. We're also going to have Bill Miller come and talk, an attorney, elder law attorney that's going to come and speak about you know, estate planning and all that kind of stuff. So, and the Alzheimer's Association will be there about all the latest research as well. And there's a lot of new research. And so it's a free event for caregivers and their families, and CEUs will be provided for nurses and social workers. Last year, social workers and nurses got 7.5 free CEUs.
Wow.
So yes, my sister-in-law comes all the way from North Alabama every day. She takes off that day. She said I can't get that many online at a time, you know. So so make sure that you come to that, and you know, if you want to be a vendor, let us know, and make sure to follow us. It's called on Facebook. We're the Alabama Cares, CARES, like back here. the little logo. The Alabama Cares Program, East Alabama, and it's on Facebook for all the details. And of course, I'll keep you up to date here on the show as well. Everybody, there we go. It's the Alabama Cares, but put the in front of it. It says the Alabama Cares Program, East Alabama on Facebook. We have all of our events listed there, even our monthly events. So make sure that you follow us on that. And yeah, I mean, we've got a lot going on. And I am so excited for you guys. You might have to be my my main
primary care providers.
Primary care person. Yeah.
Good.
My husband and I both
We
need
would love
one.
it.
Yeah, so that's awesome. So any final words that you guys would want to talk about?
Just watch for us and the things that we're going to be able to offer, and we may have to just come back once we get open and have another session where we can offer more definitive information.
Do you, tell everybody your contact information again, the website for them to go on. So
it'll be Oxford Health Systems Primary Care. We're at 1102 Luttrell Street here in Oxford. And then our number is 256-470-9998.
Okay, 256-470-9998. That's easy to remember. Yes. Okay, so that's wonderful. So, Ms. Lauren, are you excited about opening this up?
I am, and just let the community know that we're out there for them, ready to take care of them.
And what's so crazy, guys, when she got here, Miss Lauren and I knew her last name was Pollard, and I was like, my great aunt's last name was Miss Pollard. And she went to church with my great aunt a long time ago. Yeah. Small world, isn't it?
The community is alive with people like
that. But that's what is so awesome about it, and and I love doing this too because it just shows. I mean, in Alabama, we take it so for granted. We really do. But we have some awesome communities in Alabama, and right here in East Central Alabama. I mean, I'm a little partial, but I really think that our communities are some of the best. I mean, we care about each other. We want everybody to thrive and do well. And be well.
That's right.
So
yes.
So any last words with you, Miss Lauren? Did you can think of?
Like I said, we're just ready to take care of our community.
That's right.
They're ready. So at least you got out of having to unbox the boxes.
I know.
I think we got a few more coming
in. you got to be here where they had to go unbox. So is it almost like
almost ready?
Almost. So
Almost
you're
ready.
About 60-70% maybe?
Probably. Yeah.
That is awesome. So any final words about peptides?
Oh, I think you'll enjoy them. They're fascinating. They impact upon every aspect of your life.
Well, see, I'm going to have to now go research all this. So, yeah, I have to research more about peptides. So there's different peptides, you said, that affect
there's about 130 different ones.
Ah, how that is interesting. And so when you got that certification, gosh, how long did that take you?
We were there for 10 hours, a couple days in a row.
2 days in a row.
Yeah.
Like solid.
Oh, yes.
Oh, that was intense.
About 500 people there.
Oh,
So this is all over the country that this is being, brought forth, and really fascinating. Within the next 10 years, there'll be an explosion of all this.
Oh, wow. Well, so and that one last thought. So, because it's in the news about all the immunizations and everything. So, are you guys going? Because I really don't know how that works. So, immunization-wise, I mean, does a child have to go to the health department to get that, or can I get it through their doctor?
They can get it through their doctor or go to the health department, but we will offer tetanus immunization for people that need it. If they haven't had one within 5 years and they have an injury that's tetanus prone, they can receive tetanus from us. We'll also offer flu shots.
Okay.
And those are vaccines that are readily available, and I know that they're in the refrigerator this morning.
Oh, okay. Awesome. Awesome. I know it's a little controversial right now. It's all in the news. So.
Right, right.
We're not telling you to do that. It's just it's your choice. It's your choice. So we appreciate so much you guys joining us today. And there's, can y'all believe that it's already September? We're like 2 months away from Christmas.
But it's nice, cool weather this morning.
Yeah, and Yeah, I think, but see, I don't trust it.
Oh.
We're in Alabama.
I'm sure it'll
so,
get hot
you know what I
again.
mean? So I'm thinking,
Yeah.
I don't want to like get really used to it because I'm scared that Mother Nature will go, psych, you know. So yeah.
Well, we
So-
can only hope.
Yeah, I can hope. That's true. And football's always nicer when it's cooler.
That's
too,
right.
You know, so, but we appreciate you so much for watching us today. And as always, make sure that you join us every Friday. We'll have another guest next Friday as well. And you know, like I said, if you have any ideas things that you want to hear about, write me at Ellen at tv24.tv and let me know what you want to hear. I'll try my best to get it on for you. So hope you have a good weekend, and we will see you next time. Bye bye.